Hello, my name is Karishma Shah. I am a clinical nutritionist, and today I am here to talk about a very important burning topic at the moment. It's the whole connection between COVID and pregnancy and how to manage all these things around us. Today I am with someone very special. I'm with Dr. Asmita Potdar. She is a OB-GYNAC and she is an infertility specialist. She's going to be helping us today throw light on very important topics and conversations that a lot of people want answers for. So we've compiled a set of questions and we're going to be asking Dr. Smeeta all these things. Thank you for being a part of this conversation today, Doctor.
Thank you, Karishma, for inviting me. It's a pleasure.
So I will ask you the first question for today, which a lot of girls are, a little confused about. Doctor, during our menses, now that the vaccination is open, is it safe for girls to, take the vaccination when they have their periods, or is there any kind of a precaution that they need to take?
Okay, Karishma. So this has been a burning topic. There has been some viral WhatsApp message which says that one should not take vaccination during periods and you should adjust your dates of vaccination according to your dates of period, which is absolutely false. It's a total myth. There is no connection. There is no reason to delay vaccination or adjust your periods accordingly. It is said that your immunity is low during periods, but that's wrong. Your immunity has nothing to do with your periods. It's a normal natural process in which every month a lady will bleed for 4 to 5 days. That will not put her immunity compromised. It will not compromise her immunity. It will not make her anemic only in those 4 days. So if you are otherwise healthy, you have no other issues, it will not put your immunity low. So a clear message to all the women here that take the vaccine if you are eligible whenever you want. It is not to be synchronized or unsynchronized with your periods at all.
Yes. Thank you for that. A lot of girls are going to be now at relief because there's been this confusion since all these viral things have been happening. Also, doctor, on the same note, so if any woman is currently planning her conception, if she wishes to get pregnant or she's planning her pregnancy, is it safe to then take the vaccine?
Okay, so Karishma, now it cannot be a yes or no answer for this particular question, and I will have to elaborate a little on this. Like we know, the COVID vaccine is a very new vaccine. The data is not yet available whether it is safe during pregnancy or it is not safe during pregnancy. I feel it is prudent to postpone the pregnancy for say 1 or 2 months if you are eligible for the vaccine. Problem here is that now we know there is a lot of vaccine shortage, especially we are talking about Indian scenario. And in that case, if you are planning a pregnancy and you want to take the vaccine, it may be an indefinite wait. It may be 2 months, 4 months, 6 months. So what I would suggest is it depends upon how desperate you are. If you are already into taking some treatments, then you discuss it with your doctor. Otherwise, it's safe to wait for a few months. After vaccination, only you start planning. Right now, the priority is coming out of the pandemic. So if you can postpone your pregnancy plans, to postpone your pregnancy plans, take both your vaccinations. It would be first vaccination if you take it on 1st of May. The second vaccination is 6 weeks apart, and after that, after 2 weeks from the second vaccine, you can start planning pregnancy. So only a 2 months wait, but that is recommended.
Okay. Okay. Fantastic. Thank you for that, doctor. And what about women who are already, they've just delivered a baby or they're lactating mothers right now, feeding their babies? What is their steps to take the vaccination?
All right. So here I would again like to elaborate a bit. Like I said, we do not have enough data on these vaccines. Right now, there are 4 to 5 vaccine candidates which are available in throughout the world. The Moderna and the Pfizer vaccine, which are available, which are mRNA vaccines, which are available in US. So they are promoting vaccination in breastfeeding, and they are also promoting vaccination in pregnancy. Now, only in these mRNA vaccines, the Moderna and Pfizer vaccines, more than 90,000 women who are pregnant have taken the vaccine and they have seen that there are no side effects. But as far as the Covishield or the Covaxin are concerned, we do not have enough data, and both the vaccine manufacturers have said that it is better to avoid vaccination during pregnancy.
Okay.
Now, during breastfeeding, it also is now Covishield. If you note, it has been associated with blood clots. Now, the risk is very, very low. It is considered to be 15 in 1 million, which is negligible. But after delivery, immediately after delivery, a woman is already at a risk of blood clots.
Okay.
So, it would be prudent to at least postpone any vaccination for at least 2 months after delivery,
Okay.
and preferably not to take Covaxin or Covishield, which are available right now in India. If and when we get Pfizer and Moderna, we will get newer guidelines. The
Okay.
ICMR guidelines, the Indian Council of Medical Research, has said that avoid vaccination unless the woman is at high risk. That is, if she is a healthcare worker, someone who is working with COVID patients day in and day out, someone
Yes.
who is working in ICU, then a case to case basis, we can make an exception and tell the woman to take the vaccine.
Okay.
But personally, I feel that it also depends upon how much time has passed after delivery. Like if you are about 8 months or 9 months old baby, you have,
Yes.
and you are
Yes.
giving mostly solid feeds, and only once or twice you are giving him or her breastfeed. Then by the time you actually get your vaccination done, it would be another 1 or 2 months. So let's encourage women to do it if you are later in the phase of breastfeeding and your child is not really dependent on you. A
Okay.
lot of animal studies have been done, and it has been seen that actually breastfeeding and breast milk may cause some protection to the newborn if you are giving the breast milk.
Okay.
But right now, the ICMR guidelines are avoid vaccination and lactation, and
Okay.
definitely do not take it in pregnancy.
Okay. Thank you for that information, doctor. And since you are already an IVF specialist, you meet a lot of women who come to you with infertility issues. What is your advice for women who are currently, planning their IVF, treatment, or probably, they're already on the treatment? What about these women, and how should they approach the vaccine?
Right, perfect. So, this is a very important discussion going on because most of the IVF candidates are already frustrated. They have been trying for a very long time, and now is the time they feel that, okay, now I have taken a decision of IVF and I want to finish it off as soon as possible. Uh, but with the vaccine, there is a lot of confusion. Now, if we have someone who is elderly, like with a poor ovarian reserve, in which waiting is going to cause problems with her ovarian reserve, with a chance of success is going to go down,
Yes.
what can be a prudent approach is maybe you can do her IVF, that is, ovum pickup can be done. Then all the embryos can be frozen. Finish off your 2 doses of vaccination, and the transfer can be done after the vaccination is completed,
Okay.
because vaccination is not to be given during pregnancy and when you are planning pregnancy, but IVF, ovum pickup should not cause a problem. Like right now also we are any which ways doing COVID for all the women who are undergoing IVF treatment. We are doing COVID RT-PCR for even the husbands, so we know for sure that the embryos are going to be COVID free. And if in the meantime they do get the vaccine is available, then we can do embryo freezing. They can finish their 2 doses and come back for the next dose.
Yes.
For younger women who do not have any pressing need, a 2 to 3 months delay or a 5 months delay is not going to cause a problem. It would be the similar advice like in patients trying for natural pregnancy, that wait, finish off your vaccinations and then try for a pregnancy.
Okay.
Now, here I would also like to touch upon one more topic, that if there have been a lot of women who have taken first dose inadvertently, they did not know they are pregnant, and
Yes.
then they found out that they are pregnant. Now, in that case, there is no contraindication. It is not that you need to terminate the pregnancy. Enough animal studies have been done. The COVID vaccine, all the vaccines, that is the viral vector vaccines, which is our Covishield, or attenuated vaccine, which is Covaxin, or mRNA, do not cause any teratogenic effect on the baby. It will not cause any anomalies in the baby. So there is no need to panic if you have taken the vaccine, but the second dose may be postponed to at least 12 weeks, because the
Okay.
first 12 weeks are the most important, when the baby's organs are formed. And once organogenesis is completed, after that, if you want, you can take your second dose, or after delivery.
Okay.
And by that time, hopefully the pandemic will end, so she won't be able to want to take the vaccine any which ways.
Let us all hope that what you just said
Let
comes
us hope
true.
for that.
Yes,
True, true.
thank you for that information, doctor. And with all things said and done, whoever is going to be taking the vaccine now, the entire brigade is now open for everyone to come and take the vaccine.
Right.
So, what are some of the precautions that someone should take? If the vaccine has just been taken, is isolation really necessary post taking the vaccine?
Okay, so actually, isolation is not at all necessary. A lot of women ask it, especially if they have smaller kids at home, say someone who is 1 to 5 years. I don't know, but they have a fear that they may infect the kids. But these vaccines are not going to cause COVID. They may cause temporary reactions like fever or mild headache or pain at the injection site, but they are not going to cause COVID. So, isolation is not at all required. A general precaution in the sense that you should be well hydrated, you should take enough rest, and if you have any symptoms like fever or cough, cold, or pain at the side, then take rest, take paracetamol, and that's
Yes,
it. No other precaution is necessary. And of course, keep continuing to use all your COVID measures, that is masking, social distancing, hand hygiene. Vaccine does not give you a right to roam about without a mask. Vaccine does not give you
absolutely.
protection, 100% protection. So that is a very important message which should go, especially when the vaccine is now going to be available to all above
Everyone.
18.
Yes, absolutely. Thank you so much for stressing on that point, because that's very, very important for people to know that just because you've taken the vaccine, it doesn't give you a free space to not wear your masks, not do all the necessary
Absolutely.
precautions that are needed at the moment. And doctor,
Absolutely.
you very nicely mentioned the names before also. Can you tell us, the difference between Covishield and Covaxin?
Right. So technically, Covishield and Covaxin are different types of vaccines.
Yeah.
Covishield is basically Oxford AstraZeneca vaccine, which is made from it is a viral vector vaccine. Um, Different type, benign, which is virus is taken, which is not going to cause any major harm. It is the
Yes.
common cold type of vaccine. It is called as adenovirus.
Okay.
That virus is taken, and the spike proteins from the COVID virus are put on the adenovirus, and then they are introduced in our body so that we can produce immunity against the spike proteins. That is
Okay.
why everyone is doing these spike protein antibodies, because the spikes are introduced here.
Okay. Okay. And doctor, which of these two is, or is it even such? Is there even such a thing as any one of it is more safer for women who are,
Right.
already pregnant?
Right. So, like again, I would want to insist on this, that enough data is not available. Um, Neither of these are saying that they are really safe. The mRNA vaccines, which are the other two, the Moderna and Pfizer, are saying that they are safe in pregnancy.
Okay.
We have a little bit of data now, which is coming from Royal College of Obstetrics and Gynecology in UK, which says that there have been a lot of women who have taken the Covishield, that is the AstraZeneca vaccine. But yet more data is to be collected to see whether there is any long-term side effects.
Okay.
And it is just 3 months or 4 months since the time that
Absolutely.
the vaccines are available. So we do not know what will happen once the pregnancy is completed, the baby is delivered. After that, we will start coming to know if there are any effects. So
Yes.
if not absolutely necessary, like all the guidelines are saying, only if you're a healthcare worker, if you are at a very high risk of catching disease, or if you are severely having like diabetes or hypertension, which is going to put you at a very high risk of complications because of COVID, then you can think of vaccination in pregnancy. Otherwise, at the moment, there is not enough data to advise one over the other. And if we have to at all choose, maybe Moderna and Pfizer, because a little bit more data from them is available.
Okay. Thank you for that important information. And doctor, there are a lot of mothers who are currently lactating, are currently feeding their toddlers, breastfeeding at the moment. And because of the spike in the rates and everything, there are a lot of them who probably have COVID at the moment, or maybe there is a higher chance of them to get COVID or get the virus in some way or the other, or some symptoms. So how are they supposed to tackle their breastfeeding at a time like this? If they've got the virus, or maybe they are not feeling well and they're maybe thinking that they have something like this, what's the right way to approach breastfeeding in a scenario like this?
Okay, so breastfeeding is actually the most important thing which a woman should do for her baby, and it is a absolute boon. Even when the woman is having any disease like any fevers, even from the COVID virus, it actually can be beneficial if she is breastfeeding the baby, because it will pass on the immunity to the baby. Whatever immunity her body is trying to fight the virus, it will be
Okay.
passed on to the baby. So breastfeeding is never contraindicated, whatever the woman is suffering from. Maybe except for HIV. In HIV, we say do not breastfeed, but otherwise breastfeeding is always encouraged, even if woman has high grade fever. That is one
Okay.
very clear message which I have to give to all the women.
Okay.
Now, in case of if you are thinking that you have contracted COVID, in that case, the only thing is that if you do not want to directly breastfeed, you can express out the milk and someone can feed the baby. And if you are directly feeding, that is also absolutely accepted. You have to completely clean the breast, sanitize the breast, hand washing before taking the child in hand, and wear a double mask so that you do not cough or sneeze on the baby, which is most important. The aerosol spread is going to be most important. COVID will not be spread because of feeding the baby. It does not
Okay.
spread through the breast milk.
Okay.
So
That
that
is
is one
very
very
important for
reassuring
people to
thing.
know. Yes. Thank you.
Yes,
Yes.
but what happens is when the baby is in very close contact with the mother, the aerosol spread has to be stopped. So she
Yes.
has to wear a N95 or maybe wear a double mask, and immediately after feeding the baby, give the baby to someone else who can take care of the baby.
Okay. Okay. That's very, very vital. Thank you so much. A lot of women and mothers are currently confused as to how they should approach this. So, thank you for throwing light
Right.
on that. And, doctor, on the topic of pregnant mothers, if there are some women who are pregnant right now, maybe they're 4 months into their pregnancy, 5 months into their pregnancy, or maybe if they've just found out that they are pregnant, um, what is the impact, or is there actually any impact on the fetus or on the growing baby inside the mother of something like COVID?
Okay, so when COVID started in last year, we were all very worried that what will be the impact of COVID in pregnancy. But
Yes.
now over the year, we have seen so many women who have contracted COVID during pregnancy, and majority of the women come out of it without any major effects. Like almost 75%, three-fourths of the women will not have any major long-term effect or any problems with the baby. A lot of them are in fact asymptomatic because these are all young, healthy women. So they generally do very well. Uh, Earlier, we thought that there will be a high risk or a high rate of miscarriage, but it is not seen that it is more than in the normal population. But later in the pregnancy, if towards delivery, if the woman contracts COVID, there is a chance of preterm labor. So that is something which the woman has to keep in mind. The most important thing is do not panic. Always keep in contact with your obstetrician. Do not go to the clinic, because in the pandemic, the most important thing is you cannot prevent the infection for yourself, but you can prevent spreading the infection. So
Yes.
do not go to the clinic. Teleconsultation is available. All the doctors these days are doing teleconsultation. So count your pulse, count your saturation. Pulse oximeters should be available for all COVID patients. If the pulse ox shows normal oxygen saturation, if the pulse ox shows normal pulse rate, and if the fever is in control, then there is nothing to panic. Just stay at home for 14 days, eat a lot, drink enough fluids, loads of fluids, and take adequate rest. After 14 days or 17 days, when your quarantine is over, only then come to the clinic, and then we can do monitoring for the baby for sonographies and everything else. Even the important sonographies will be missed because of the COVID. If the anomaly scan or the NT scan is coming, unfortunately, in those 17 days, that will be missed. But we can always do it later and sort out whatever it is. It is will be case to case basis, but there is nothing to get panicked about. Like I said, mostly 75% of the women will come out of it without any major problems. The remaining 25% will probably need oxygen admission. Fortunately, the bed issue is never for any pregnant woman. The pregnant women are always given beds in hospitals. We have kept reserved beds for patients who are in labor for COVID deliveries. So there
Yes.
is a different ward in which they can be taken care of. And
Okay.
all doctors will take care of COVID patients. No doctor is going to say no to you just because you are COVID. So don't try to hide that you have any symptoms. Go ahead, do the testing. That is the way to prevent pandemic, to prevent the spread.
Okay. Okay. And Doctor,
And
lastly, if yes.
continue with your supplements like iron, calcium, zinc, vitamin C. These are the things which are going to help you boost your immunity. Proteins are very important these days. I think a lot of people are just concentrating on zinc and vitamin D, but your basic nutrition is equally important. Proteins are very important in your diet. So have loads of proteins and take lots of water and take rest. That is the only thing which you can do for COVID. Of course,
At the
steam
moment.
inhalation, hand washing, wearing mask and everything continues.
Thank you. Thank you for so much information on, the precautions that someone can take if they found out that, they're pregnant right now and they've been affected by the virus. The most important thing that you mentioned was to not get into a panic mode and worsen things around you, but probably handle it in a more better way, because, I think everyone is available to have conversations today. Until the time that it doesn't become
Absolutely.
serious, it's still manageable at the moment. And as you said, that the chances are quite low of anything going wrong with the baby or with the fetus until and unless the mother is fine.
Right.
Thank you once again, Dr. Asmita, for all this beautiful information that you have given us. I think every woman, maybe even if she was planning her pregnancy, or any kind of doubts that she had in her mind regarding her periods and the vaccine, pregnancy and the vaccine, her current baby and the vaccine, lactation and the vaccine, you've answered everything beautifully. Thank you so much. Firstly, I would
My
also like to
pleasure,
thank you
Karishma.
on the behalf of everybody listening, that you've to you and all the doctors as well, for working so hard, for being in the front line of things, and in spite of everything that's going around us, to still maintain calm, to still maintain your cool, and help people around you. I think it's hats off to you for that. Thank you once again for that, and then for this conversation. So
Thank you.
it's been a pleasure to ask you these questions, get all your lovely feedback and expert advice on it. And I'm sure that everybody who's listening will be benefiting from some of the advice that you have given.
Thank you. Thank you. It's been my pleasure. Thank you so much.